HIV/AIDS, as we know, is a serious notifiable infectious disease that is pandemic in nature, and it affects people of all ages, children, old, young, and adults. And World Health Organization reported that Nigeria was the third country on HIV/AIDS burden chart since the first case of HIV was officially reported in Nigeria in 1986. The number of cases continue to rise at alarming portions, especially among women of childbearing age of 15 to 49 years. The National HIV Seroprevalence Study conducted in 2001 revealed that about 5.8% of women attending antenatal clinic were HIV positive. Since the majority of pediatric HIV infection worldwide is known to result from mother-to-child transmission, the prevalence of pediatric cases is expected to rise. Mother-to-child transmission is transmission of human immunodeficiency virus from infected HIV-positive mother to a child during pregnancy, labor, delivery, or breastfeeding. The transmission rates from 15 to 45% in the absence of any intervention is increasing. These rates can be reduced to levels below 5% with effective interventions such as voluntary counseling and confidential testing. Now, voluntary counseling is a counseling and confidential testing given to and received by women and men of all ages, and particularly childbearing age, to detect their HIV status. In 2007, around 370 children under 15 became infected with HIV, mainly through mother-to-child transmission, while about 90% of these mother-to-child transmission infections occurred in Africa, where AIDS is beginning to reverse decades of steady progress in child survival. Statement of problem. One would expect that with the high level of information on HIV/AIDS, it is the mode of transmission, its preventive measures such as voluntary counseling and confidential testing, and prevention of mother-to-child transmission strategies, the rate of HIV/AIDS should have reduced drastically among pregnant women and children, but the reverse is the case. Observation of records from health facilities revealed that many of these pregnant women attend faith-based organizations where they don't have qualified health personnel to give them health education on HIV/AIDS and how to prevent it. Some of the pregnant women, because of shyness, ignorance, and lack of money for hospital services and treatment, prefer faith-based homes. Since most of these faith-based homes do not have facilities and personnel for voluntary counseling and testing to know the HIV status of these women and treatment with antiretroviral drugs when tested positive, there's tendency for the children born by pregnant women attending these faith-based homes to be infected during pregnancy, delivery, and through breastfeeding. This made the researcher to carry out this study on pregnant women's knowledge and attitude towards prevention of mother-to-child transmission and voluntary counseling and confidential testing. The objectives of the study: one was to assess the knowledge of the pregnant women on HIV/AIDS. Two, to assess the knowledge of the pregnant women on prevention of mother-to-child transmission and voluntary counseling and confidential testing, to assess the attitude towards prevention of mother-to-child transmission and voluntary counseling and confidential testing uptake, and to identify factors responsible for the pregnant women patronizing faith-based homes. Significance of the study: this study will add to existing information about pregnant women's knowledge and attitude towards prevention of mother-to-child transmission and voluntary counseling and testing uptake. It will increase awareness and knowledge of pregnant women, providers of care at faith-based facilities, and the society at large on prevention of mother-to-child transmission and voluntary counseling and confidential testing. This will thus lead to reduction in the spread of HIV/AIDS among children. The literature review: effective PMTC requires a range of services, and so it is mandatory that women attending faith-based clinics also receive education on how to prevent mother-to-child transmission. While this represents an increase from 10% in 2004 to far low to allow a population response, in fact, the pediatric HIV epidemic in resource-limited epidemic in resource countries. HIV testing coverage among pregnant women in Africa in 2008 from 16% in Western and Central Africa to 28% in Sub-Saharan Africa and 43% in other countries. In the absence of provider-initiated testing and counseling in antenatal clinic, testing rates remain low, even where antenatal care attendees are high. I want to go to the prevention of mother-to-child transmission. In resource-rich countries like the United States, there has been dramatic progress in reducing mother-to-child transmission since 1994, when the Pediatrics AIDS clinical trials demonstrated that a regimen of zidovudine given during pregnancy, labor, and to the newborn reduced transmission by 67%. Current objectives of VCCT, according to global strategies, were acceptance of the test, provision of care for HIV-infected individuals, particularly pregnant women, prevention of HIV/AIDS transmission, and psychological support. Less developed countries like Africa are gradually instituting VCCT as part of their primary health care package. In Nigeria, access to care, counseling, and support for HIV/AIDS and STDs is one of the 10 national priorities. However, when VCCT services are available, they are often not acceptable. The overwhelming majority of African women appear to accept HIV testing, but only a proportion in respect of intervention trials return to get the results. Methodology. The descriptive design was used for the study. Questionnaire was used to elicit information from the participants, and the questionnaire was subjected to face and content validity. The reliability of the instrument was tested using test-retest method, and the reliability coefficient was 0.75. The study was carried out at Christ Apostolic Church, Isalake, and CAC Ago-Ijesha, Ijaye branch in Abeokuta. So the number of women attend these facilities to receive antenatal care, and that was why these facilities were chosen. The data collection, the sampling technique was purposive sampling technique, and it was used to select the 2 faith-based organizations used for the study because of the large turnout of pregnant women attending NACDA. Simple random sampling technique was used to select 50 women each from the centers, making a total of 100. And the procedure was carried out twice for 2 consecutive clinic days. Hello? Okay. So data collection and analysis
You have
given to the
hello.
participants.
You have another 2 more minutes.
Data analysis, which the results showed that
Yeah, you have another 2 minutes.
30% of the pregnant women were within the age range of 15 to 25 years. 43% of them were women. 80% were married. 63% were Christians, and 34% were Muslims. 24% were public servants, 30% were business women, 35% were petty traders, and 11. So on awareness of HIV, these 82% of them were aware, while 92% of them were aware of VCCT. Sources of information include ANC Talk, radio, TV, and mission houses. The reason for why they are not using that, why they preferred faith-based, was that it was near to their house. Some of them attributed to prayer activities. 22% attributed it to low cost of services rendered. 20% to enjoying better nursing care, and 16% due to closeness. On knowledge on HIV and the PMTCT, out of the 100 respondents, 60% of them said HIV is a killer disease and is preventable, while 56% of them said it can be transmitted through sexual intercourse. 40% of the mothers said transmission can be through placenta, and so on. 70% of the respondents reported that HIV mothers can breastfeed their babies, while 30% said it is unadvisable for mothers to breastfeed their babies. HIV mothers to breastfeed their babies. On prevention of mother-to-child transmission, 42% of the respondents reported giving ART during delivery, 38% said delivery by cesarean section and avoiding breastfeeding, while 6% said giving ART to the newborn will prevent mother-to-child transmission. So of the 80% now that attended, HIV mothers, while 20% of the respondents said it is not advisable to deliver in the hospital. Voluntary counseling and confidential testing, most of them were not going for voluntary counseling because of shame, and some of them due to the belief that they cannot contract the disease in their lives, and the 2% was 10% was due to fear. Discussion and recommendation. The participants had adequate knowledge about the HIV and means of transmission, but the major thing was that they were afraid of attending the clinic where they can get adequate care. So there's nobody that cannot contract HIV if necessary precautions are not taken.